Hey there, it's Dr. Jim, and I have a question for you. I'm sure you know what ADHD is, attention deficit hyperactivity disorder. But did you know that our internal system, known as the endocannabinoid system, plays a significant role in ADHD? Let me explain. There's been a great interest in exploring the endocannabinoid system's role in various physical and mental health conditions, including attention deficit hyperactivity disorder, or ADHD. Pharmacological approaches to the treatment of ADHD include psychostimulants like Adderall, as well as anti-anxiety and anti-depressant medications, all of which come with potentially harmful side effects. It's also estimated that between 10 to 30% of individuals with ADHD do not respond well to these medications. They don't tolerate treatment with these medications, and sometimes they just stop taking them. Therefore, a natural, safer, alternative approach is desirable in the treatment of ADHD symptoms. I'd like to provide a very short review of ADHD just in case you have forgotten some of its characteristics. Attention deficit hyperactivity disorder, or ADHD, is a blanket term used to describe a group of behavioral symptoms like impulsiveness, inattentiveness, and hyperactivity, which are developmentally inappropriate and impairing. ADHD is also associated with emotional dysregulation, cognitive impairments, and psychiatric co-occurring conditions, usually including anxiety and depression. Important question. It's in science. There's studies being done, people writing about this. Can ADHD be an endocannabinoid deficiency disorder? That question fascinates me immensely. Recent studies have linked the development of ADHD with dysfunctions and deficiencies within the endocannabinoid system, which is vital for emotional balance and cognitive function. Two important endocannabinoids, AEA and 2AG, show decreased levels in a variety of both physical and psychological disorders, including ADHD, autism, Parkinson's disease, Huntington's disease, and schizophrenia. That's fascinating. So depletion of two important endocannabinoids are associated with these conditions. It is therefore hypothesized in science that ADHD might actually be a disorder of the endocannabinoid system, and that discovering a treatment that targets the endocannabinoids may bring symptom management or symptom relief. Now, let's look at some common pharmacological approaches to ADHD, basically medications, prescription drugs. The first line of treatment for ADHD is an amphetamine-based medicine like Adderall and Vyvanse, as well as non-amphetamine-based medications including Concerta and Ritalin. Because these medications may not be well tolerated for some individuals, another line of treatment involves anti-anxiety and antidepressant prescription drugs, which may also, unfortunately, have unpleasant side effects. Here's something very interesting in understanding the connection between ADHD and the endocannabinoid system. Dopamine, anandamide, and FAH inhibition. I'll explain. There's a connection between these three: dopamine, anandamide, FAH inhibition, and ADHD. First, Dopamine is a transmitter and a hormone responsible for movement, memory, mood, motivation, as well as how individuals feel pleasure and rewards. It's our bliss neurotransmitter. It's our happy neurotransmitter. Dopamine deficiency then would lead to what? It's a major contributor to a lot of different things, but now ADHD. Second, anandamide, or AEA for short, is another neurotransmitter within the endocannabinoid system that regulates many functions, including mood, cognitive processes, pain, and appetite. Anandamide deficiency has also been shown to play a role in ADHD. And third, fatty acid amide hydrolase, which is FAAH, is an enzyme that reduces anandamide. The connection, I know it sounds like chemistry class, but the connection is this. Dopamine releases anandamide, resulting in therapeutic value for symptom management and relief in ADHD, and cannabinoids that slow FAAH's degradation of anandamide can also better manage symptoms of ADHD. Kind of complex, but after you look at it for a while, you start to get it. So I do have some final thoughts on ADHD and the role of the endocannabinoid system. ADHD is a common developmental condition that presents many behavioral and cognitive challenges to the individual, and although several stimulant and non-stimulant based medications are currently available, they often present negative and sometimes dangerous side effects. A safe and natural alternative treatment is highly desirable, and it appears that targets within the endocannabinoid system may manage or reduce symptoms of ADHD without pleasant side effects, and that would be great. The challenge now is finding the right cannabinoid to help the endocannabinoid system do its work. And until then, I'm just going to keep researching on and on and on. I'm Dr. Jim. Thank you for your time and attention. Keep coming back for more interesting information. Thank you for watching the video. I appreciate it. And I'd like to introduce you to my book, Living Longer and Stronger with CBD. I had to write this after reading between 500, 550, 600 medical articles written and published all over the world. I had to condense the findings into one easy-to-read book on the health benefits of CBD for physical disorders, for mental, emotional conditions, for neurological and neurodegenerative health problems. I guarantee you are going to find this book very helpful for yourself, for friends, colleagues, family members. It's on sale at Amazon.com, but you can check it out at drjimcollins.com. That's drjimcollins.com, or follow the link, okay? So thank you again for your time, and check out Living Longer and Stronger with CBD.